Okay. Today I'm going to tell you how to answer microbiology question in the theory university examination, where even it is a 5 mark question or a 15-mark question, you have to mention these. I will be discussing what all side headings you have to mention to get the maximum amount of the marks, so that the examiner finds your paper very attractive. Uh, before going into the topic, I want you to take a screenshot of this. Okay. Here, for explaining you guys, I'm taking the example of the diphtheria. If the question given is the diphtheria, first we have to mention the name of the disease. The disease is diphtheria or respiratory diphtheria or whatever is given in the question. What causes, next we have to mention about the causative organism. Causative organism here is the Corynebacterium diphtheria. Next, what is the classification of that organism? The classification, if anything is present, like for Corynebacteria, Corynebacterium diphtheria, Corynebacterium species classification is present, and morphology. Next, we have to mention about the morphology of the organism. Like morphology should be given when it is a virus or a protozoa. Like HIV virus, what is the shape of the virus? Uh, a protozoa means a hookworm. What is the shape of the hookworm? We have to draw the diagram. Next, what is the pathogenesis of the diagram? So, how the disease is caused? We have like in Corynebacterium diphtheria, it is inhibition of the protein synthesis. So, we have to mention the steps. Next, uh, risk factors. What are the risk factors? Like Corynebacterium diphtheria, for example, it is mostly observed in the children. You have to mention all these points, and these all you already you know these points, but you have to mention and in a format so that the examiner can understand better your paper. So, risk factors like in children. What is the mode of the transmission? Mode of the transmission is through air. Next, what are the sequence of the events leading to the disease? For example, rheumatic heart disease or myocardial infarction will have sequence of events leading to the disease that maximum try to do it in a flowchart. Next, coming to the clinical features. Clinical features we can observe bull neck and pseudomembrane formation. These all we have to mention in the clinical features. And if any stage-wise clinical features according to the time, if they are present, you have to mention the stages also. Laboratory diagnosis is a must and should in microbiology questions. The laboratory diagnosis is different for the protozoan viruses. I'll be making a video about the lab diagnosis of different organisms, what is the basic proforma in the next videos. Laboratory diagnosis, like basic, the specimen, what is the specimen collected, what is the smear, what is the culture media, what are the special methods, you have to mention them. What is the treatment? Next, what is the treatment? After the treatment, how it should be prevented. The prophylaxis. What are the vaccines like DPT, pentavalent vaccine? You have to mention up. So this is you have to, even if you know or don't know any point of the answer, make sure to mention all of these side headings with a black pen and try to present it very neatly so you can get the maximum marks out of this. So this is the topic for today. Thank you.